for tuning in to NCE Prep with Portia, Part 3. As you know, I'm pinpointing major things you should know to pass the NCE. This isn't everything you need to know, so please don't use these videos alone to study. Use them for more of a guide since there's so much information to understand in order to pass. Major disorders to master. I have a good bit listed. There's a plethora of other disorders, but these are the most common. Familiarize yourself with what each one may look like on a client. I can for sure say I saw more than 5 scenarios on one of the versions of the exam asking me to diagnose the client. The question gave me the symptoms and the answer choices were disorders. Don't try to memorize every little detail. Just know the main things to look for when it comes to diagnosing. For an example, ADHD in children. You know to look for inattentiveness, lack of focus, forgetfulness, impulsive, lack of emotional control, and so on. You know that symptoms must be present for a specific duration and disrupting more than one area in their life, like home and school. You may already be familiar with the disorders listed, but how they word the scenario could trip you up, so there's no harm in refreshing your memory, just in case. Developmental and life issues. Familiarize yourself with Erik Erikson's developmental stages, which I will be going more in depth in another video. Grief models, attachment styles, identifying development, and aging and cognitive decline. As always, I have a cheat sheet to review the day before your exam. For a quick study session, focus on suicide assessment, bipolar versus depression, PTSD versus ASD, substance use criteria, borderline personality disorder, OCD versus psychosis, and child versus adult presentation differences. If you have time, please review the disorders on the previous slides as well. They are just as important to know. Remember, think like a counselor. This helps people who are fresh out of internship or already working in the field. When you come to a scenario, pretend it's your client sitting right in front of you. Assess for safety, consider developmental stage, rule out anything medical. Use the least invasive intervention first and follow all legal and ethical responsibilities. As always, thanks for watching, and I'll see you in part 4.